Hello, I'm Dr. Craig, and I've started a new blog recently. Part of the blog will be interviews with different practitioners that I've been working with. I hope that this will help you get a better idea of their style of practice as well as their specialties. The first one I'm going to be interviewing is one that works just across the hall. Her name is Dr. Mona Bhalla, and she practices general naturopathic medicine.
Okay, in a nutshell, uh, several things. First of all, never had any intention on becoming any medical professional whatsoever growing up, and it wasn't the field I was going into. But when I was in undergraduate college, I ended up getting quite ill. I had various internal bleeding symptoms, and the physicians that I went to, nobody could figure it out, but nobody spent the time with me to try to figure anything out. And then it wasn't until probably the 12th doctor I went to, after many specialists and many tests that all came back negative, that a doctor actually stopped to ask me the question about what I was doing in my life. And at the time, I was holding a great amount of stress. I was, getting ready to graduate with my undergraduate degree in a field I wasn't excited about working in, and I had a lot of anxiety, but it wasn't diagnosed as such. And she actually prescribed to me to take a break and go on a vacation, and it just so happened that that was happening, and all my symptoms resolved during that time.
Wow.
From that, and no medications, because I had tried many things that only made things worse,
Right.
in the past. And so that was sort of the beginning, I would say. If there's a moment when a seed was planted,
Mm-hmm.
that was it, where I realized there's something to this whole stress affecting your body. I was only 20, 21 at the time, so I didn't, consider myself so vulnerable to such things.
What were
And
How does it work at naturopathic college? I know they have people that do dual degrees and they have different specialties. I know at this clinic, everybody seems to have their own niche or specialty.
mm-hmm.
Um, when you were at the school, had you started to specialize even at that point and kind of picture and see what your practice would look like in the future? And what were some of the things that
Honestly,
struck you?
I've avoided being too much of a specialist.
Okay.
The reason being is I feel like where naturopathic medicine actually shines is in its ability to see the whole person and all the different factors involved, and how that, I worry about focusing too much in one area and then missing
Mm-hmm.
where other factors are involved. So I enjoy the variety too. I really enjoy being able to help people in many different aspects of their health, and not just if they're having a digestive issue, but also if they're experiencing joint pain, and they're often related to one another. So I've remained a family practice physician, so I do see, men, women, children of all ages, starting at a month old, usually. So, and I enjoy that. I definitely, over the years, have focused a bit more in some areas where I feel there's more help needed and where naturopathic medicine can particularly shine. And I would say, uh, of those areas, a lot of that involves like mental, emotional symptoms, like a lot of mood issues, sleep, fatigue, just people dealing with the stresses of life and how that influences them. And so I've gotten into like different particular areas where we can test, non-mainstream tests to
Mm-hmm.
actually find some imbalances and correct those with naturopathic means. Well,
This
I like the idea of patient empowerment. I mean, that's really important to me, that people feel that there's things that they can do, that they have control over, and even go through a process of self-discovery as to what those things might be, whether it be changing something that they do as a habit, or what they eat, or their sleep hygiene. There's certain things that it's not just relying on I do dispense a natural pharmacy. I have many options to choose from. I mean, I work with herbs, I work with homeopathics, I work with nutrients and many other forms of naturopathic medicine. So I have a wide, range of tools to choose from. But within that, I always like to, impart to patients that, the decisions that they make can make a big difference too. And, outside of the office, outside of what I prescribe to them, their own, life and how they choose to live it can really make a big difference in their health. Yeah, I mean, simply put, I would say just holding space for a patient is so valuable. And what I mean by that is allowing people the time and, free of judgment, just suspend all judgment and allow people to talk about what's going on with them. It may be their only time to do that in a day or a week or a year. I mean, they may not have that opportunity where anyone allows them to just speak freely without a feeling of being judged. And that's what I feel like I excel at. I'm very open and I let people speak freely in this room, and a lot can come from that, and I can discern a lot of potential treatment avenues from what people say alone.